Usually, when people discuss safe sex, people mean using a condom. And condom use is so incredibly important, especially in the world that we live in and the societal norms and cultural views that are predominant today, where dating apps and hookup culture and casual sex and friends with benefits are becoming a social norm. Now, if you're not engaging in those things, that's fine. But all of those things are presently mainstream. People use apps. They use social media, Facebook, Instagram, Snapchat, to communicate and connect with others, and often to hook up with others. There are dating apps, dating websites, many of which are used to find romance, but there are many who are used to simply find someone to have sexual relations with. And so people are using apps such as Tinder and Grindr, depending on their sexual orientation. And those are just two out of a long list of apps to choose from. There are so many choices that people have. Oh, and speaking of Tinder, I should make this public announcement. I am now on Tinder. Yes, I am. Well, not exactly. I am not on the app itself, but I am on their website. They have a website that features all sorts of articles dealing with different topics. And in fact, I wasn't sure. I had no idea that this even existed until someone contacted me about a piece that they were writing. And so you can check that out. The article I'm featured in is titled Every Social Media Action in Your Life Decoded by Gabriel Kessel. And that is currently up on the Tinder website. If you'd like to read that, it's an interesting article, and you can check that out. So yes, these platforms are popular. And social behavior really does revolve around the idea of hookups, dating apps, and friends with benefits. And I'm not telling you this because this is what you should be doing. And I'm also not telling you this because you shouldn't do these things. Please understand, I'm simply saying that all of these things are very common. What I will say is that since 2014, STIs, sexually transmitted infections, have been on the rise. And it's really alarming. In both the United States and in Europe, and I'm sure other places, there is such an increase in the transmission of these STIs. Let me share a little information with you. Since 2013, syphilis diagnoses have risen over 76%. Gonorrhea has increased over 67%. And even more so, and what may be very surprising to you, is that 45% of those diagnosed with chlamydia are between the ages of 15 and 24. And that's really staggering. And part of the reason for this rise in numbers is a lack of sex education. I believe that firmly. I firmly believe that part of the reason is because of sex education. You say, oh, we do this in school, but it's never anything in depth. You show a couple slides. It's very outdated. What is taught often in sex ed programs in public schools in the United States is simply done in a way that is to try to scare the children. Well, they might be not all children. Depending on the age that sex education begins, some of them are adolescents, are teenagers, and they are trying to scare them into not having sex by showing them the results of sexually transmitted disease. And that is not a positive or helpful way for sex education. And believe me when I tell you that as a sex therapist, I talk to so many people who are simply not aware of many things related to sex and sexuality, even if they've gone through a sex ed class in high school or middle school or in 5th grade. Much of the information that people get is often from the internet. And unfortunately, this information is not always the most reliable, especially if you do not know where to look for reliable information. The good news is that there are many treatments for some STIs. But it is essential that you are diagnosed early and that you're treated early. And we're going to be doing some shows that cover these topics later this year. But it's really essential that if you are experiencing any symptoms, that you do get checked by a physician. Because if you do not receive treatment early enough, treatment is available for many of them. But if you do not receive the treatment early enough, there could be some serious long-term effects from something that could be easily treated. This is why you must think about safety when you are engaging in sexual activity for your health and the health of your partner. Many people, when they hear safe sex, it's become almost synonymous with using a condom. But I will tell you that I don't like hearing condom use referred to as safe sex, because this really is not an accurate term. Theoretically, condoms are 98% effective in preventing pregnancy. However, even Planned Parenthood has noted that in actual practice, they are only 85% effective. And much of that has to do with the regularity of condom use, the improper use of the condoms, and we're going to discuss a lot more about that next week. But even with STIs, no condom is 100% effective. They are very good, and you should use them. I encourage you to use them, but they're not always 100% effective. The only real safe sex is no sex. And I don't mean that to be funny or to sound prudish, but the only real sex is safe sex or masturbation. Unless you're doing something, really crazy that could cause damage.